Okay, good afternoon. So the next panel is on a important topic, which is how do we begin to use the available technologies to do intensive longitudinal assessments of health and behavior across a wide set of different conditions. So you're going to hear from a set of speakers who are all working together in a new research collaboration that's been funded by the NIH and that we're fortunate to be a part of today. We're going to hear first from Dana Wolff-Hughes, who's the program officer at the NIH at the Office of Behavioral and Social Science Research. Next, we're going to hear a combined presentation from Donna Sprout-Metz and Billy Naum-Shani, who will be talking a little bit about how do we engage participants in these kinds of longitudinal assessments. Next, we're going to be hearing from Stephen Antilli, who's also he's here at Northeastern University, and he'll be talking a little bit more about engagement and how some other work that the network has been doing in that area. And then finally, you're going to hear from Matt Nock, who's here at Harvard University on a study that's part of this network tracking suicide in adolescents as part of their contribution. So I'll let you look in your programs for additional biographies of each of the speakers, but I think in this, the theme of this year's conference of really looking across the lifespan, I think this group is trying to see if they can take sort of a collective approach across a number of different projects which have their own unique aims, but are adopting some of the similar methods of using phones and wearables, as well as in-person assessments to try to track illness and morbidity across a range of conditions. We're trying to sort of figure out ways to harmonize the data collection, while also in some cases, as you'll hear about, incorporate some of those just-in-time interventions. So it's both research on assessment, but also how to time interventions to be the most efficacious. So with that, I'll turn it over to Dana, who will present sort of an introduction. Thank you.
So thanks. So as Justin said, I'm Dana Wolff-Hughes. I'm in the Office of Behavioral and Social Sciences Research, and I'm going to provide a little bit of some background to kind of set the stage for what the investigators part of the network are going to talk to you guys about. So you guys may or may not be familiar with OBSSR. We are an office within the Office of the Director of NIH, so we function a little bit differently than your typical institute or center at NIH. We're focused more on coordinating BSSR research at NIH and communicating health-related behavioral and social sciences research to our various stakeholders. But importantly, the background of where this network came from is we have 3 strategic priorities. And our second one is about methods, measures, and data infrastructures. And we're very, very interested in the impact and the use of mobile health and digital technologies within behavioral and social sciences and how they can be used to further our understanding of health and disease. But in thinking about intensive longitudinal health behavior assessment, and thinking about the theories and models of behavior change that are typically used, we've kind of come to this realization that while BSSR typically places a really strong emphasis on these theoretical models to systematically explain and predict events influencing health outcomes, they're not necessarily dynamic based off of the way that the models were actually formed from the data that was collected. So typically they were 1, 2 time points assessed and helped develop that model. And they didn't necessarily incorporate the dynamics of behavior or the intensive measurement approaches that we now have to test the models now. So with that, we, in 2018, formed the Intensive Longitudinal Health Behaviors Network to leverage the advancements in sensor technology, data availability, and volume. And the goal was to collaboratively study factors that influence key health behaviors and the dynamic environment using these new methods and approaches in order to reduce disease risk and optimize health. And so with that, we have a research coordinating center, which is our first one from Dr. Chow, and then below that are all the UL1 projects. And you can see in red, these are all the health behaviors that the different projects are actually assessing. And so we have a lot of variability in them, but there are 3 that are focused on in this mental health space. And as the network has progressed, they've considered some different themes that need to be taken into account. And I know that Billy and Donna and Matt and Stephen are going to talk to you more about some of these, but they include privacy and security and ethics, to use of common data elements. When do you use EMA items? How do you time them? Do you harmonize the measures across these different projects? Or standardizing, or maybe it doesn't matter? Where are new analytic approaches that can be used instead of forcing everybody to use the same measure? Engagement, the issues around data sharing and modeling and data analytics. And before I turn it over to Billy and Donna, I'd be remiss not to share with you guys some mHealth related funding opportunities out of NIH. One is a K-18 here that is focused on this cross-training issue that Wendy alluded to earlier with your typical behavioral social science researchers and those typically in the computer engineering space. And then second, Wendy mentioned this before, she directs the Smart Connected Health initiative at NSF. It's a partnership with NIH, and you can speak to me or Wendy. I now coordinate the NIH side of that, although Wendy used to coordinate the NIH side of that as well. So with that, I'll turn it over to Donna and Billy.